I'd like to take this opportunity to welcome you all. Thank you very much for joining us. We have a distinguished panel tonight representing experts from UBMD, from Pediatrics and Internal Medicine, OBGYN, and Child Psychiatry, here to give presentations and answer your questions about issues involving our kids getting back into the classroom where they belong, although it's certainly an unusual time, and it's been an unusual time and a tough time for the last year and a half. I'd like to screen share with you now. So back to school, but not back to normal. We have a distinguished panel of experts who I'll introduce individually as we go along. At the end, we'll do questions and answers. Those can be submitted through the chat format. I'd like to thank Megan Veers, our Director of Communications, for doing the lion's share of work in setting up this town hall. I'm going to give a brief update on the pandemic, one I've given various stages over the course of the year, and it's sort of subtitled Why We Are Where We Are Right Now. We have a number of waves in our community. The first wave in January to April of 20 obviously affected New York City, Boston, some of the metropolitan areas. The second wave really was summer in the Midwest. I hate to call it a second wave because it's an area of the country that really never had a first wave. Then we had a number of third waves in the fall. Early November, we had a big spike here in Western New York when the weather got cold. And then we had bumps after Thanksgiving and after the holidays. Then there was sort of a wave 3.5 in April. That was when the Alpha variant arrived here. And we've had fourth waves now hitting terribly, starting in the Midwest, going Michigan, Missouri, down the Mississippi, and now into the South and Southeast, Texas, Florida, places really where the hospital systems are in danger of being overwhelmed. The original virus, the one that we dealt with in 2020, had an incubation period of 4 to 6 days. It really hit the elderly hard, a case fatality rate of 20 to 25% in people 80 and up. It featured asymptomatic and pre-symptomatic spread, and loss of smell and taste was a common feature. And pediatric infections were thought to be rare. You know, kids are under 18 or are 80 million, a quarter of our country. It was pretty rare to have serious pediatric infections, but not unheard of. And then the Alpha variant emerged in England, came to this country in the spring, gave us our spring spike. And now, of course, we're dealing with the Delta virus, which replicates quicker, is more contagious, and based on some recent results published this week, may be more lethal than the original version. Cases in this country as of yesterday, the spring cases were low, but of course were very deadly. You can see the spikes we've had. This big spike in the winter is our fall spike. First when it got cold, then after Thanksgiving, then after Christmas. Then it came down, and we were down here doing pretty well, but now Delta is here. It's important to note that in this country, because of the problems of not being vaccinated, the hospitalization and the death rate have gone up with the case numbers that you see. And you see in the lower right-hand corner and the center, hospitalizations and deaths, both going up with the increase in cases, which is what you would expect. This is happening in Erie County too. I just direct you to the far right side. You can see the number of cases going up significantly. This shows up in hospitalizations as well. The third week of June, there was one patient with COVID at Buffalo General Hospital, none at Suburban, none at Oshai. Clearly, those numbers have gone up, but happily, the last few days, I can report they've been relatively flat, and that's good news. I'd like to just mention the effect of vaccination with Alpha and Delta, and this is from the United Kingdom. And the one thing you can say about them is they have good information from their healthcare system about what's going on. These two graphs on the left are the same time period. The blue is the number of cases. The gray in the bottom are the number of deaths. And it's important to note they had a terrible spike with deaths in the spring here. Then they had their fall spike, which they sort of controlled. Then Alpha hit them. They had a major amount of death. They started vaccinating everybody with one dose of vaccine because that helped against Alpha. They had a sharp drop in cases. They've completed an aggressive vaccination program with 2 shots, and 2 shots helps against Delta. And here's the proof. The blue cases at the end here show the Delta virus going way up. The death rate has not gone up in the United Kingdom, and that's because of their aggressive vaccination strategy. Clearly, vaccination prevents death from this condition. So children and the Delta virus, what's the difference? I mentioned that pediatric infections seemed relatively rare in 2020. They were thought to be mild. There was something called a multi-system inflammatory state that was relatively rare. But in 2021, we had the epidemic of the unvaccinated. Pediatric cases are rising in proportion to their part of the population. So clearly, Delta is somewhat different. The message I'd like to give is vaccines remain effective. Remember, the original vaccines were 100% effective in the trial against death and 95% effective against illness. That's like the Bills winning the Super Bowl 5 years in a row with shutouts. That was an outstanding result. Now we're talking about 65 to 85% effectiveness. That's still a great number for a vaccine. Full approvals are arriving at this time, and approvals in children are expected soon. So now we're going to begin. We're going to start with Dr. Dennis Kuo, who's the Division Chief in General Pediatrics for UBMD Pediatrics, the Interim Division Chief for Developmental Pediatrics, an Associate Professor at the Jacobs School of Medicine and Pediatrics. Dennis.
Hi, good evening, everybody. Let me go ahead and get my screen shared here. Perfect. So good evening, everybody. I'm going to be talking a bit about school safety and COVID for children and also those with special healthcare needs. The message is we really want to get back to as much as normal as we can get given the circumstances. And we'll go through an overview of keeping students safe and review the guidance for school openings. A lot of news recently with Erie County providing school guidance that really does parallel American Academy of Pediatrics and Centers for Disease Control guidance. And we'll talk a little bit about special populations towards the end. The take-home message is that compared to last year, there was plenty of evidence, tools, and experience that we have now. The guidance we have really is excellent, and Erie County does follow CDC and AAP guidance. The reason we know it's excellent is because we have an excellent Department of Health that has really followed very closely the outbreaks that may occur within school and community settings, and we really know what works and risky situations. It is important to pay attention to community COVID-19 rates, and as long as we implement and adjust multi-layer protection, we should be able to get all of our kids back into school. Our goal this year is to get all children back to being in person. We know that time away from school leads to interruption in support, social services, social isolation, food insecurity, and there's also a reduction in physical activity. And there's a disproportionate impact on our Black, Latinx, and Native American, Alaska Native children. Last year, there were, on the whole, here in Erie County and throughout the country, relatively few outbreaks in schools, albeit with strict adherence to protocols. And the kids and the staff and teachers are really generally getting COVID outside the school setting. We also, however, did not have the Delta variant, and we had far fewer vaccinations than we do right now. That said, we strongly believe that schools can operate safely with protocols. There has been some experience over the summer with outbreaks, but that always occurred when protocols were not being followed. So what's coming this year is that children will attend school in much larger numbers than last year. We have tools we didn't have last year. We have vaccines for 12 and up. We have a lot more testing. We have a lot of data and experience. We also have, throughout the country, widespread community transmission. But again, this is largely caused by abandoning safety protocols. We know that Delta is more contagious. It is still somewhat debatable how inherently more dangerous or uncontrollable it actually is. But the virus is still regarded as being transmitted by respiratory droplets. And really little has changed about our understanding of how we mitigate community transmission. There's been a lot of discussion about, trying to rely on the vaccine, but the vaccine is not 100%. And really, a vaccine is never 100%, which means we really have to go back to enforcing the community transmission protocols that we know actually do work. So the risk of schools, the best thing for protecting schools is low community transmission. However, we know in Erie County, and Western New York in general that the community transmission is actually very high right now. So the next best is that we have to have strong school protocols. And when protocols are followed, transmission in schools is lower. They do continue to parallel community transmission. But historically, most cases in the school settings tend to happen with the adults, staff to staff. The kids seem to be relatively protected, but again, we have to follow protocols. The transmission in the high school settings appear to be more common, which is really not as surprising because transmission in adolescents does tend to parallel adults. This is a slide that comes from the National Academy of Sciences reopening K-12 schools during the pandemic, and it was published last year. This actually comes off the OSHA diagram for hazardous substances. The thing is that we have to look at COVID as a hazardous substance, and it's very worth taking a look at this and seeing how we use this to eliminate or reduce the threat of COVID at schools. At the top, you'll see the elimination pyramid, bottom of the pyramid, or the wide part of the pyramid. And as it goes down to the bottom here with at the point, you'll notice that at the very top, it's most effective hierarchy and the least effective at the bottom. The most effective way to protect against COVID is to actually eliminate the threat, which means that you have to crush the curve. And this is where things like the vaccine and really just eliminating cases comes around. If you can't eliminate, then the next layer is substitution, which in the past we really used for as a distance learning. If you are using in-person learning, you have to then go to engineering controls, which are things like isolating people from the hazard, including density and ventilation. And administrative is really changing the way people work, which includes things like training in new routines, such as hand washing, and really asking folks to face the same direction, distance from each other, and reduce large gatherings. You'll notice at the very tip at the bottom here is PPE, which is mask and face shields. And therefore, mask is really just one layer, which it plays a critical role if the other four layers really aren't as robust as they need to be. And with that in mind, Erie County Department of Health last week released its guidance with a combination of mandates and strong recommendations. We placed a lot of emphasis on layers of transmission. So layered protection means that there's multiple layers, multiple interventions that schools do to be able to reduce the threat of COVID within schools. We start with universal indoor masking, which really is a mandate from the county and coming from the state as well. Distancing equals a greater than 3-foot distance between students and classrooms, 6 feet for everyone else. The daily screener, stay home when you are sick. Big emphasis from the county on staying home. Contact tracing means that when you have a case within the schools, we need to test, trace, and isolate. The schools are being asked to make sure that students have assigned seating, which means that if you have a case in the school and you have someone that is underneath the close contact, that you know which students are and you isolate those students. If you don't have a seating chart, you're going to have to quarantine the entire classroom. Ventilation, hand washing, respiratory etiquette, a lot of emphasis in education within the school settings, and finally, make sure as many people as possible are vaccinated. The role of screening testing, which has come up in the CDC AAP guidelines as well as Erie County, is that the schools may offer regular screening of asymptomatic individuals, particularly if you want to focus on unvaccinated teachers and staff, particularly if we're in the yellow, orange, and red zones. Weekly testing is suggested in those instances, but schools are increasingly utilizing resources coming from the county and the state that are now available to set up screening tests, which are typically PCR swabs. Now, this is different from diagnostic testing, which is when you have symptoms, you need to know if you have COVID. So to go to children and youth with special healthcare needs, the approach is very much the same in that you have to look at a multi-pronged and multi-layered approach to safety. But since some children with special healthcare needs are at risk for biological disease, more severe disease, we are asking folks to be creative, flexible, and responsive to safely achieve inclusion. When I mention about advocating for inclusion, the reason behind these strong protections are that children and youth with special healthcare needs should have the opportunity to attend school safely, which means that in short, we have to reduce as much as possible the transmission of COVID in schools. Most children and youth with special healthcare needs can safely attend school when protocols are followed by all. We advocate shared decision-making between the family, the school, and the physicians around the best options for optimal education environment. And these may be including things like looking at the classroom density, looking at the PPE that may be available in the classroom, particularly for those that may be at risk for severe biological illness. For children and youth with special healthcare needs who are at particularly high risk, we recommend the following. First is to make sure that families do discuss with doctors and schools, consider the level of risk that the child may have. We know that some of the highest risk conditions may be lung disease, neurodevelopmental disability, cardiac disease, and obesity. But again, take the community prevalence and the safety protocols and procedures into account. Be creative and flexible and accommodate students as much as possible. Preference for larger ventilated, better ventilated, less crowded indoor or outdoor spaces. In classrooms that may have children with special healthcare needs, schools are paying attention to the density of the classroom. Heightened attention to PPE, surface cleaning, and hand hygiene. We recommend that students have their IEP, individual education plan, updated based on current needs, as well as compensatory services based on what may have happened in the last year. Also, if students are virtual, consider home aids nursing to assist with learning, and consider arranging virtual and home-based therapies. One additional thing to discuss is the issue of mask exception. That has received some press for students who families have concerns about their ability to tolerate a mask. We do emphasize that almost all children can safely wear a mask or a face shield. We want students to have their families work on this at home. We recommend a model of explaining the mask, asking the child what is comfortable, modeling wearing the mask, and finding what mask may be comfortable for the child, and using gradual desensitization with practice. Don't rush or try to force a child, even if you do 5 minutes or even 1 minute with the first several days, to try to get the child to wear a mask safely and comfortably. That is the kind of patience you have to be able to have some children be able to tolerate masks safely. You also want to find out what the school policy on masks. The Erie County Department of Health guidelines talk about the possibility of reasonable accommodation, which means that you do have to take into account community transmission, vaccination status, the resources available in the school, because the school does have the need to be able to make sure that as many children as possible can have safe accommodations within the school setting. Therefore, it is about making sure that all children are safe and have a safe learning environment. And we recommend in your discussions to have risk and benefits discussed of in-school versus home learning. There are some children who actually do quite well with home learning, although again, on the whole, we want children to be in school as much as possible and try to get back to a state of normal. Again, you want to look at the prevalence of COVID-19 in the community, look at your ability to test, trace, and isolate, understand the layers of school protection, and also consider where the child may be exposed. Buses, for example, are an area which tend to be a little bit higher risk, and so you want to take a look at all of these into account. These are some references. The American Academy of Pediatrics, the Center for Disease Control, and the National Academy of Sciences have excellent resources that can help guide students and families. And Erie County has excellent guidance that I posted a link to at the bottom. Thank you very much for the opportunity to present and discuss. There will be a question and answer at the end of the session of all the speakers, and I invite folks to put their chat questions into the question and answer feature. Thank you.
Thank you very much, Dennis. Please submit your questions so we can deal with them at the end with the panel. Up next, we have Dr. Alberto Monegro, who's a sleep medicine specialist with UBMD Pediatrics and Internal Medicine, and is an assistant professor in the Department of Pediatrics here at the Jacobs School of Medicine. UBMD Pediatrics has a sleep center, which is a really critical area for our children and our adolescents, teenagers, and we're going to hear some about that in terms of best sleep practices for back to school with the immune system and vaccine efficacy.
Great, thank you. My part of the talk will focus on best sleep practices for back to school, and I'll focus a bit too on a very fascinating topic about sleep and its relation to the immune system and vaccine efficacy. Our hope is that by the end of the talk, we'll be ready to start the year strong with good sleep habits and to help ensure that our kids are successful in school and safe in school. So as we know, the pandemic really disrupted schooling for millions of children across America. And this created sort of a ripple effect that affected their sleep and sleep habits. And sleep is fundamental to the physical and mental health of children. In fact, children sleep for more than half of their lives. Sleep is essential for their development and growth. As far as the brain is concerned, sleep is a very active state in your day. It is the main job of infants and children, so to speak. It plays a vital role in attention and memory, emotional and behavioral stability, and hormonal and metabolism regulation. In fact, for instance, just to give an example, growth hormone is released in sleep. So what are the effects of poor sleep on children? Now, you don't need a medical degree to know a lot of this. You just have to be a parent. And clearly there's a lot of stress at bedtime for both the child and everyone in the household. And the child can be hyperactive and have ADHD type symptoms and irritable and temper tantrums and have aggression. There are other sleep effects, maybe not as well known, but sleep, at least in the sleep world, is very much associated with obesity, childhood obesity, and impairment in focus and learning and decision-making and memory, and also related to depression and anxiety. In fact, inadequate sleep in teenagers increases their risk threefold of attempted suicide. So sleep is very important. On the subject of sleep and vaccine efficacy, this really is a very fascinating topic. And what the literature has said is that sleep duration at the time of vaccination can affect immunity. Just to name a few studies, there's been various studies looking at the hepatitis A, B, and influenza vaccine. One of them was in 2002 in JAMA when they looked at about 25 subjects, and half of them, they deprived them of sleep at night. They could only sleep 4 hours. And the other group, they were able to just sleep a normal night's of sleep. And they received the flu vaccine on the 4th day. And when they checked the antibodies on the 10th day, it turned out that those that were sleep deprived had lower antibody levels, which is very interesting. There was a follow-up study, somewhat similar. This was in Journal of Immunology in 2011. And they also looked at a small group, about 27 subjects. And they gave hepatitis A in a usual schedule, but they asked half of the group to not sleep the day of the vaccine. And so this deprivation of sleep happened after. When they measured the antibody levels, again, those that had a normal night's sleep, in this case it was from 11 to 6:30, had higher levels of antibodies. They also had higher levels of interferon gamma, which also helped inhibit replication of the virus. So very interesting that both sleep deprivation before and sleep deprivation after vaccination were associated with lower antibodies. Now, what about sleep and immunity in general? What about those children that are less than 12 or older than 12 and not vaccinated? Does a good night's rest in some way protect them from developing a viral infection? And the literature suggests that it may. In fact, there was one paper that was done in 2009 in JAMA, where in the Journal of American Medical Association, where they actually took a number of subjects, and half of them, they instilled a drop of the common cold, the rhinovirus. Actually, all of them, they instilled a drop of the rhinovirus, and those that had less than 7 hours of sleep were 3 times more likely to develop symptoms 5 days after, which is very interesting. So even having good sleep can be, we think, protective against infections. What about sleep in relation to the risk of COVID-19 illness? This is a very interesting survey that was done in 6 countries that looked at over 2,000 high-risk healthcare workers that were exposed to COVID-19 patients. What they found was that every 1 hour increase in sleep duration at night was associated with a 12% lower odds of COVID-19 infection. In addition, having 3 sleep problems compared to those without sleep problems also was associated with a twofold increase of COVID-19 infection, which suggests that maybe having good night's rest and having good sleep hygiene in some way could be protective against COVID-19. Now, a lot more research would need to be done on this subject to know this definitively. What are the factors that have disrupted sleep quality and duration during the pandemic? Well, we know that there was a higher level of stress and anxiety in our families. We are all at fault of it. We're watching TV with our children next to us, and we're all worried. There was an alteration of bedtime and wake time. The usual cues, such as the school bus or the parents' work schedules that help determine when their children would wake up, sort of fell apart during the pandemic. There was more screen time as well. And not all screen time is detrimental. Certainly, it helped us adapt to the pandemic, and it helped us stay connected with family and friends. But more screen time, especially in the evening, led to worse sleep habits. There was also a reduction of light exposure in the morning. We were all at home, indoors. And light, as we know, is a very important cue and timekeeper for our sleep-wake schedule. It sort of synchronizes our sleep-wake schedule. Without that, our bedtime and wake time can be disrupted. We also were under emotional stress because of social isolation, and children also had lack of access, and adults too, to outdoor activities that they were used to. The problem with insufficient sleep, the truth is, was there even before the pandemic. When you look at the CDC data from 2015, it showed that 6 out of 10 middle schoolers did not get enough sleep. 7 out of 10 high schoolers did not get enough sleep. And so the problem was there. The pandemic just worsened it. For your reference, the recommended amount of sleep for children highlighted here in the table, if you look at school age groups 6 to 12, the recommended hours of sleep are 9 to 12 hours. For adolescents, it's 13 to 8, for its adolescents 13 to 18, it's 8 to 10 hours of sleep. Now, adolescence is a time marked by needing less sleep and wanting to sleep later, but that doesn't mean that sleep is not important. So what are the best sleep practices for back to school? I'll highlight a few. Number one, it's important to maintain an age-appropriate bedtime. So that means that if you know your child needs to wake up around 6 to 7:30 and they're 6 to 12 years of age, then they should be asleep by 7:30, 9 p.m. to try to achieve that 9 to 12 hours of sleep. Now that 9 to 12 hours of sleep is a range. What you really would need to ask is, how many hours of sleep does my child need to feel fully rested? And that may vary. So some children may be less than 9, or some children will be 10 or 11 or 12. As far as adolescents, if they need to wake up at 6 to 7:30, then they would need to be asleep by 9:30 to 11 p.m. to achieve their recommended goal time of 8 to 10 hours of sleep. Number two, keep the same bedtime and wake time routine on weekends and weekdays. Your sleep-wake cycle does not know whether it's Monday or Saturday. And so maintaining that schedule is going to go a long way for you. In fact, sometimes we associate weekends and relaxation with staying up late, and in some cases playing more video games and being up much later than you should. But from a biological standpoint, that's not very relaxing to your body. It puts stress on the body, certainly when Monday comes around. And it's important to have a routine that is relaxing and enjoyable. And it may be a time when family can bond and grow together. So it may be something that your children can look forward to. Number three, limit exposure to bright lights in the evening. We know that light, in particular blue light, stimulates the ganglionic cells in the retina and signals your brain to stay awake. And so light affects your sleep-wake cycle so that you sleep later and later. Number 4, limit screen time prior to bedtime. Again, there's nothing inherently wrong with screen time, but again, the light from the screen will over time lead you to sleep later and later. Now, light in the morning is a very good thing, but in the evening, it can be detrimental. Number 5, do not eat a large snack prior to bedtime because as your sugar rises, then you'll be less likely to fall asleep. And number 6, avoid napping during the day. Sleep is like food. Once you eat, you have a decrease in your appetite. And once you sleep or nap in the same fashion, you have less of a sleep pressure, so you're less likely to fall asleep at night. Now, you may find yourself having a child that doesn't have the right bedtime, and so you can ask, well, how do you transition back to school? Well, start moving the wake up time and the sleep time a little bit earlier, closer to the school wake up time. And you can do that over the course of a week or two. Make a plan for limiting screen time. If you have an adolescent, try to engage them in a conversation so that they can be involved in that decision making and feel that they have input in that plan. Try to stay consistent. So maintain the same routine with different activities throughout the day. Your body functions best when it is on a schedule. And finally, start early, especially if the sleep schedule is very far off from what the school times allow. Thank you so much.
Thank you, Alberto. Up next, we have Dr. Sarah Berga, who is chair of the Department of Obstetrics and Gynecology at the Jacobs School of Medicine, she is a reproductive endocrinology and infertility specialist and a relative newcomer to Buffalo. Welcome, Sarah.
Thank you. It's lovely to be here. Now I just have to find my slides and I'll be with you in just a minute. So I wanted to talk about why it's important to get vaccinated for your family, fertility, and childbearing. So I'm going to hopefully can see this. Let me get that up. Maybe Megan, you might need to help me here. Oh, there, share. Okay, share my screen. Okay, terrific. I don't know if you can see me, but if you can, that's great. And I'll show you my slides. And what I would like to talk about is really what we've just said. To reinforce the idea that vaccination is safer for all aspects of reproductive function than not getting vaccinated. And I know that this has been confusing for folks. And because we were trying to be cautious, and in the beginning, we didn't really include pregnant women in the studies, and we weren't really sure. So since that time, fortunately, a huge amount of information has emerged. And now we know that men and women seeking to conceive and those undergoing infertility care should get vaccinated. And in fact, what we have for data is actually very reassuring. And in terms of fertility for women, there's no increase in the risk of infertility, miscarriage, and no decrement in eggs and or sperm quality for men and quantity. So what we do know is that by getting COVID-19 may impair the brain message to the ovaries and the testes, and actually cause a decrease in ovulation, impair fertility, cause a decrease in spermatogenesis, and cause infertility. So what that looks like is that we really want to be able to protect fertility by using COVID-19 vaccination. And people have been really worried about this because they thought, oh, this could get across the placenta and hurt the baby. And if it's in my body before I get pregnant, it might actually cause my eggs to have the COVID-19 vaccine in it. And that does not happen. And then people thought, well, if I get vaccinated in early pregnancy, I might have a miscarriage. And there's a lot of what I would say chat groups that actually have promoted this idea. And now we know that it's not true. And I am happy to bring these data to you. So in terms of sperm count, we actually have a study showing that sperm motility and sperm count is decreased for up to 90 days after COVID-19 infection. And that is really nothing you want. And so it definitely can impair fertility. And that's the problem. Control. Oops, somehow I stopped sharing. Let's try that again. Okay, it's just not advancing, Megan. I know, I see that. I don't know what I did differently. So, try one more time. I just can't get it to advance. But anyway, I'll keep talking and basically want to say that then the next part that people have been worried about is what would happen if you got vaccinated during pregnancy. And, you know, the data on that are really sad in terms of what happens if you are not vaccinated during pregnancy. And so if you get COVID-19 during pregnancy and you don't get vaccinated, what we find is that there's a very large increase in the risk of actually needing a lot of help. And the kind of help that people need is mechanical intervention, ventilation, and really oftentimes like 50% increase in the likelihood of a preterm delivery. And that is not a great thing. And so I would love to be able to show you those data. Not sure why I can't get that.
Hi, Dr. Berga. If you would like to stop your screen share, I can try to share from my end in advance for you.
I think that would be a good idea. It just won't advance. I'm not sure why that is. Thanks, Megan. There we go. Okay, so let's go forward. There we go. Perfect. So that's just a slide showing that sperm counts don't change after vaccination. So it's this waterfall plot showing that on average sperm counts actually increased, and that probably is seasonal. And there was very few decreases, and we know that sperm count isn't stable anyway. So basically, this is very reassuring data. Just came off the presses July 2021. Next slide. And then I wanted to talk about pregnancy, which is a very special opportunity to be vaccinated by mom. Next slide. And so the alarm bells were sounded when we found out that only 16% of pregnant women in the United States as of May 2021 had been vaccinated with one dose or more of COVID-19 vaccination. And then we got an even more of I would say, a louder alarm. Next slide. When we realized how bad things are if you get COVID-19 during pregnancy. So this is a year's worth of data. It's almost 1 million women. About 20,000 women had COVID-19 infection, and the others did not. And what we found, and this is odds ratio, so it means risk, is a marked increased risk of an early delivery, and almost a 50% reduction in the likelihood of making it to term. Term is anything after 37 weeks. There was almost a 6-fold increase in the need for ICU admission and a 14-fold increase in the risk for respiratory failure and mechanical ventilation being needed. But even more alarming is a 15-fold increase in the risk of dying during pregnancy. So we think of pregnancy as a happy time, and it's not happy if you get COVID-19 infection. And so what can we do? And these data are actually before the Delta variant. So now we see these really sad stories, next slide, that emerge in the literature and the press. And it's just heartbreaking because this should be a happy time. And here's a mom who holds her baby and has had a preterm delivery in order to save the mom, but mom doesn't make it. This is exactly the situation that we want to avoid. Next slide. So how can we do that? Well, we want to reassure everyone that it is okay to get vaccinated at any stage of pregnancy. And so far, almost 139,000 women have been vaccinated. And this idea that it could integrate into our DNA is just not there. We don't have the enzyme needed for that to happen. This virus can cause havoc. This vaccination does not. And I think it's been really an important point to reassure people, because there's always fear when you're pregnant that you might do something to your unborn. And we don't want people to have fear. We want them to have action. Next slide. So everybody has joined the bandwagon, and everybody, I mean all the groups that have something to do with maternal health in the United States, all agree now. So this is as of July 30th, 2021. We heard the worries, we heard the concerns, but we also saw the emerging problem of women being too hesitant about getting vaccinated. So what can we say? Please get vaccinated. Next slide. So another potential benefit that probably has been underemphasized is that the antibodies that mom makes during pregnancy can pass into baby. And this is also true for the antibodies that mom has when she's lactating and breastfeeding baby. Next slide. So when pregnant, the baby's cells go into mom and the mom's cells go into baby. And that's what's shown here. These are mom's cells going into baby, and this just happened to be a boy, so baby's blue cells are coming into mom. And this exchange is actually really important and very fundamental to pregnancy. And it means that we can vaccinate mom and vaccinate baby at that time. Next slide. So we don't have to stop vaccinating during pregnancy. Once delivery has occurred and we breastfeed, we can continue to vaccinate baby. And this is Mother Nature's real plan all the time anyway. You know, mom survives an infection, makes antibodies, and gives baby that protection. Next slide. So in August, we really had the data we were waiting for all this time. It was a new analysis of registry data from the CDC. And they showed no increase in miscarriage among pregnant women who got the mRNA vaccine before 20 weeks. And prior findings had already showed no safety concerns when vaccinated late in pregnancy, i.e. after 20 weeks from mom or baby. So this very explicit and terse recommendation from the CDC that COVID-19 vaccination is recommended for all people aged 12 and older, including people who are pregnant, breastfeeding, trying to get pregnant, or might become pregnant. That includes everybody. Pregnant and recently pregnant women are more likely to get severely ill with COVID-19 compared to non-pregnant people. So get vaccinated now is kind of the bottom line here. Next slide. Men too. You know, what we want is for baby to come home to a household that's safe. And if everyone in the household who can be vaccinated has been vaccinated, this is safe. And so we've shown that it doesn't affect men's fertility. So this is not just a message for a pregnant mom or a mom who's recently delivered. It's a message for mom's family. Next slide. And children have been shown to be a source of transmission. So as soon as we can get children vaccinated, we really want to. You know, we want to build this wall of immunity around baby so that baby has the best chance of surviving possible. And that is really the main message. This is a family message, a family health message. If you want to protect your fertility, you want to protect your family, please get vaccinated. Everybody who can should get vaccinated. Next slide. I just hope that we can do this together. I want to reassure everyone that we are really on board and wanting to, you know, whatever messages you may have heard before, we really want to dispel those myths and encourage your participation in getting vaccinated so that we can hold back the impact of this virus on our community. And thanks again for inviting me to be here. It's a terrific privilege. I'm sorry for the audiovisual, but thanks again.
Thank you, Sarah. And again, the message regarding vaccination is so important. We started off cautious. Please discuss with your obstetrician. But now it's get vaccinated. It's an individual choice, but it has consequences far beyond. We don't do medicine by social media or popular media, although certainly medicine is in the media now all the time. But earlier today, someone sent me a story of a woman, mother of 6, pregnant, she and her husband not vaccinated. She died of COVID after emergency delivery of a preterm infant. The husband is critically ill with COVID and will likely die. You have 6 children who are without a mother and will likely be without a father. 100% preventable deaths. So please, you know, take that message home to your family and to your friends. Early on, the message was we didn't really know, and COVID was more of a disease of older people like me. And the message was, if you're over 50, get vaccinated for yourself. And if you're under 50, get vaccinated for yourself, your family, your community, and your country. But now we see this as a disease of all ages. So our final speaker of the evening is Dr. Michael Adragna, who's a child and adolescent psychiatrist with UBMD Psychiatry. Works on the psychiatric liaison service at our Oshai Children's Hospital. And he's going to talk about managing anxieties about return to school. Michael.
Right. Thank you, Kevin. I don't seem to be able to highlight the share my screen option. Megan, could you put my slides up for me?
Yes, give me one moment.
Okay. Okay, great. Thank you very much. So I'm going to talk, as Megan said, about how parents and families can help manage anxieties about the return to school, which is a very widespread source of anxiety, as we can see in our first question right now, too. Next slide, please. So just a brief review to begin about the basics here of what is anxiety. So anxiety is a feeling of worry or unease about an imminent event, like going back to school next week, or something with an uncertain outcome. So there are some things that, you know, there's a lot of uncertainties coming up next week as far as how school will look this year compared to last year or the year before. Other examples of times when, you know, we experience anxiety around uncertain outcomes are things like separation from a parent, which is part of the return to school, tests and exams, which are a part of the return to school in any year, especially for older kids, regardless of COVID. And then there's other things like the Bills versus Steelers home opener, where there's a lot of uncertainty around that, but certainly of a less serious nature. So some anxiety is good. And good anxiety has a protective function. So there's some role to worrying. If you're a caveman and you hear a lion roar, there's a function to the anxiety that tells you to either get ready to hide or run away or what have you. And if you have concerns about COVID, the anxiety can help you and your family prepare for how to keep yourself safe, as we've talked about. Next slide, please. So is this year different? So yes, it's definitely different, but it's also at the same time not terribly different. So all local schools of which I'm aware are having classes in person. Some might have options for special situations for kids to stay home. But as far as I'm aware, all local schools have the option for all students to be in person this year. Sports and clubs or extracurriculars activities, for the most part, are happening. And that's a great thing for kids because kids generally experience less anxiety when they're physically active and also when they're engaged in routines. But one of the tenets of disaster psychiatry, for instance, in the aftermath of a tornado or a hurricane with widespread destruction, is to have kids engaged in the regular things that they do, even if those things don't seem important to the adults around them. So if you have a neighborhood soccer club, as soon as you can clear the debris out of the way, it's important to get the kids back playing soccer again to instill within them a sense of normalcy and that things are okay. Obviously, school is also going to have some social distancing to the extent possible, some places more than others, and school is going to have masks in place this year, and those things will feel somewhat different than previous years. Next slide, please. One of the best ways to overcome anxiety is to educate yourself. Knowledge is generally power, and knowledge is certainly power over anxiety. So first of all, it's useful to consult reputable sources. The CDC website has a lot of good data on it for parents to consult, as well as summaries of recommendations for school districts. Also, your pediatrician is generally a good source of information. It's much better to consult those sources or attend a webinar like this than to spend all day scrolling through Twitter and Facebook. There's some really bad information on those social media sites. There's also some good information on those sites, but it's important to keep in mind that those sites are designed to keep the reader reading. That's how they stay profitable, and nothing keeps people engaged better than anxiety. When you're anxious to see what comes up next on your news feed, you're certainly going to keep scrolling. So those kinds of platforms thrive off of anxiety, and it's important not to give in. Preparing for the occasional disruption is also a good way to overcome anxiety this school year. There certainly are going to be, progress is not a straight line. There are certainly going to be some setbacks along the way. Some people will get sick. Some schools will have to, probably have kids quarantine or what have you after certain exposures. These things might happen, but just because there's a setback doesn't mean that the cause is lost and doesn't mean that it's not a worthwhile endeavor to keep plugging ahead. And finally, talking openly and honestly with your child. So some children make known every thought they have and ask their parents lots of questions and share all of their thoughts and anxieties. Other children tend to be pretty quiet and reserved, but pretty much all children right now are at least thinking about COVID to some extent, either how COVID is going to affect them or how the restrictions around it are going to affect them. And it's important to ask your kids what's on their mind and talk with them as openly and honestly in an age-appropriate way as you're able. Next slide. As far as kind of looking at knowledge as power over anxiety from another perspective, there are some bright spots despite some of the sad stories that we have within the pandemic. Obviously, vaccination rates for adults locally could be better, but I'm a glass half full kind of guy. And compared to a lot of areas, we have some pretty good local vaccination rates for adults. There's only been 8 pediatric admissions to Oshai Children's Hospital of children or adolescents or people under the age of 18 that have had symptomatic COVID illness since June 1st. So it's pretty rare that kids have been sick enough to require admission to the hospital. And not just those children, but all of the children admitted to Oshai with COVID illness since the pandemic began have survived and have gone home from the hospital. Most infections among children are mild. So there are a lot of asymptomatic infections and mildly symptomatic infections. And fortunately, the majority of infections in children are not severe. Next slide. So other ways, other things to keep in mind about maintaining some calm as we all get back to school. The most important factor to mention probably is that adults set the tone. So some psychiatric problems, such as depression, for instance, tend to be pretty genetic. If you have depressed parents, you're likely to have some depression. One thing that's unique about anxiety is that it's more related to your parents' behavior and current emotional state than it is any sort of genetic history. So the behavior that parents demonstrate in the home will generally set the emotional tone for their kids when it comes to anxiety, especially around a big event like going back to school after a pandemic, or in the midst of a pandemic, I should say. It's also important to maintain consistency with routines and schedules. As Dr. Monegro was talking about before, the biggest example of this is a consistent sleep schedule, getting to bed around the same time every night, getting up the same time every morning, and having some fun future plans built into that consistency. Having a kid able to think about something kind of outside of themselves when they're at school, so they're not just thinking about what what the risk is of being in school in a pandemic, but being able to look forward to something fun, whether it's a family game night or going going out to throw a ball with dad or what have you. And finally, again, I just want to mention, as I did a couple slides ago, because it's so important, to talk openly and honestly with your kids. Nobody really does better when we try to keep our worries bottled up, because they end up leaking out usually in a more harmful way than if we just talk about them and acknowledge them when they're there. Next slide. Additional ways to cope. So this could be a very long list, but if there are any parents watching that are sort of wondering what's meant by the term coping skills, or what can we give our little one to do when they're really worked up, it kind of depends upon the age of a child. But if we're talking about preschool, kindergarten, and maybe some school-age children, there's one concept that began in the world of kids with developmental disabilities, particularly autism, is called social stories. So social stories are kind of short little, you can kind of make them yourself, a few panels long, of almost like a cartoon diagram of what your next day is going to be like. So tomorrow morning, you're going to get up, we're going to have breakfast as a family, but then you and your sister are going to get on a bus and go to school. And then when you get home after school, mom's going to be here and dad's going to come home later, and so on and so forth. Usually 4, 5, or 6 panels, just kind of outlining what a kid can expect. A kid could even take that kind of thing with them to school and, look at it, hide it in their lunchbox and take a look if they need to. Transitional objects, in other words, a note from a parent or a little keepsake, something the size of a keychain that a kid can keep in their pocket. Again, just to kind of have something to remind them of home and the people that love them and are rooting for them, that they can kind of touch or look at or think about during the day if they're beginning to feel overwhelmed. Taking some deep breaths with your kiddo before they get on the bus or get out of the car to go into the school. With younger kids, you probably want to do that with them. And then having some evening family fun, so something relaxing that the family can do to all kind of decompress. So we're not just talking about COVID or everybody scrolling through their own phone separately from everybody else. In adolescence, these kinds of coping skills can look a little bit different. Things like guided meditation, deep breathing, progressive muscle relaxation. And although we don't want to encourage too much screen time, YouTube has a lot of great examples of guided meditation and progressive muscle relaxation that'll teach people how to go through little 5 and 10 minute exercises at home. Next slide. Finally, reasons to ask for help. So sometimes you might have done all those things and people are still feeling overwhelmed and anxious and ill at ease. If you notice that your child is having sustained changes in mood, sleep, and appetite, so everybody is entitled to a sad day or a night of tossing and turning now and then, but if these problems are significant and sustained, that's a good reason to ask for help. Also, if you encounter an outright refusal of going to school, or see other behaviors in your child that are really a marked change from previous behaviors or previous tries to go to school. Those are all good reasons to ask for help. And then finally, next slide, who do we ask for help? So a good place to start is the social worker at your child's school. Some schools have larger social work departments than others, but this is generally a good place to begin asking for help. And also, as I mentioned before, your pediatrician is a great resource. Pediatricians are really knowledgeable not just about how to keep kids safe physically, but also about sort of what constitutes enough of a reason to determine the need for additional counseling outside of school. If that kind of work is necessary, they can certainly direct you in to the appropriate place. I think that's all. Next slide. So conclusions. It's important to keep in mind that some anxiety in a situation like this is expected. This school year is going to be closer to normal than last year, but still have more uncertainty than a typical school year. But there's many reasons to feel good about what's happening with the return to school. Adults, it's on you guys to set the emotional tone. And if it's necessary, there's help available. Thank you.
Thank you, Mike. A great presentation about a really important part of this whole adventure we've been going through the last 18 months. The slide that you showed about the number of kids who've been admitted to children's with COVID infections important. We all have to realize that the number of kids who've been admitted during this pandemic with significant behavioral or mental health issues or self-harm has exceeded that, from the disease itself. So we really have to think these things through, and we have to get these kids back to school. And so thank you very much for that presentation. We have a few questions that have appeared on the chat. The first one asks about kids and their masks because they use them, they personalize them. Now they wear it for 5 days in a row. Is it effective against viral infection, and does it actually become a source of infection if there's too many bacteria that have accumulated in it over the course of time? Dennis, do you want to comment on that? Or?
Yeah, I think it's a good question. I think that we have to look at what happened over the last 18 months. And when kids were wearing masks, pretty much all causes of illness dropped, like, significantly. We really did not see kids coming in with, our officers were very quiet. We didn't see kids coming in with colds. We didn't see kids coming in with RSV, parainfluenza, influenza, just all the standard scourges. And I'm sure there were kids out there that were wearing a mask for days at a time without necessarily washing them. And, I think what this actually does is it'll cause us to forever to rethink how we address the winter viruses, because we tolerated a fair amount of infections in kids, and certainly we do want it's getting some of these infections as a natural part of building natural and healthy immune system, but there's a limit to what we really should be tolerating as well. So we haven't seen any evidence that this is a problem. We do know that in the times of this pandemic right now, we want to limit the amount of spread of COVID as much as possible. So I don't think it's an issue.
As a neurosurgeon who wears a mask for all day, I can tell you can do it, but not the same mask, at least a surgical mask day after day. A paper disposable mask needs to be disposed of at end of day. A cloth mask with multiple layers probably needs to be washed every so often. So
yeah, and I'm not recommending you do it. I definitely recommend cleaning it, but as far as I wouldn't worry about it too much.
All right. One of the questions that came up, comment that feels inevitable that kids are going to get COVID. Hearing they'll likely be fine is not necessarily reassuring. When can we expect a vaccination for children? Currently, the Pfizer is approved fully as of this week, really, for 16 and up, and the emergency use authorization is age 12 and up. We don't yet know when the trials will be reported on children. Some preliminary results have been out. Dennis, again, more of a pediatric question. In your crystal ball, can you say when children under 12 could potentially be vaccinated?
The latest crystal ball projections are probably by the end of this calendar year. There was a push, particularly among the American Academy of Pediatrics as one medical society, to really try to get the vaccine out sooner, and we'll see where that goes. The issue appears to be a request for 4 to 6 months of follow-up data That said, there is no evidence at any point in like vaccine history that you're going to really see additional downstream side effects once you get past 2 months out of the infection. So, whereas I think we recognize that we have to be, appropriately cautious with children, we recognize that we've got a huge pandemic on our hands. We do have to look at the different doses in children, and I think that is something we need to study. But there is a push to try to get it out sooner than the end of this calendar year. That's the latest.
Next question up is, what do you say to someone who thinks they don't need the vaccine because they have immunity from COVID infection? There's a few preprints out there, and I'll comment on this briefly. Certainly, prior COVID infection does provide a degree of protection against subsequent infection. Many people who think they had COVID may or may not have had true lab documented COVID. The immunity provided by the vaccine in both the laboratory tests that we do of immunity and in population studies demonstrates that the vaccine is much more effective at generating strong, protective, and lasting immunity. All immunity does fade with time. That's a situation where boosters may be required. Certainly in the elderly, it fades quicker than in younger individuals who are immune suppressed for a variety of reasons, from anti-arthritic medications, steroids, transplant rejection medications, all the way to chemotherapy. Those individuals have fading immunity. That's the group that's going to be teed up first for booster shots. And then the other part of immunity fading is not that the immunity fades, but that the virus itself can change, and there can be antigenic shift like we see with flu. Certainly it's not going to be as frequent as we see with influenza, but there may be further shifts of this virus that require additional vaccination or boosters down the road. In terms of how we measure immunity, there's 4 major parts of the immune response. The one that is most cited in the literature, in the lay literature, is measuring serum levels of a particular antibody. That's actually the least important feature in terms of the immunity for against a viral infection. So please get vaccinated. It's far safer than counting on a COVID infection, although natural immunity is part of the solution in getting to herd immunity. There's a question about going to daycare. Those toddlers in daycare, we used to joke about them being vectors of disease. And I'd like to have one of our pediatricians, Dennis, if you can comment on that as well.
Sure. There's looking at the rest of the questions, the broad comment I'll make is that we have an excellent group at the Erie County Department of Health, and as part of the school guidance from the CDC, they also recommend working very closely with the Erie County Department, with the County Department of Health, and they have a lot of experience with what they're seeing. The bottom line is that the only times that they're seeing outbreaks in schools and daycares if protocols are not being followed. If you have children who are unmasked and going to school, or teachers who are unmasked and are going to school with symptoms, then that is when they're seeing outbreaks. If protocols are followed, then they're not seeing outbreaks. We really have just not seen outbreaks in daycares if protocols are being followed. And so that's why the school guidance is so stringent. But if we follow these layers of protection, it really should be quite fine.
Another question, somewhat related to that, but more in the school setting. Son with a compromised immune system, is the 3-foot setting going to be safe in terms of proper distance in that situation? Is there any other measures that need to be taken?
Right. So then the measures that are taken include excellent ventilation, and I know the schools have looked at that. The universal masking. So 3 feet, the county is not seeing transmission at 3 feet between students if they are masked. If they're not masked, that's a different story, but if they're masked, it's fine. You look at the orientation of where students are seated. You look at seating charts to make sure you know where everybody is. You have to make sure that, to the extent possible, if you have symptoms, you stay out of school. So all of these layers do contribute. So the distance is an important part, but it's not the only thing. And when you put all that together and you follow protocols, there's a fair amount of research now and experience across the country and experience at our county level that we're not seeing outbreaks if all those are followed. And I think the school districts here have taken this very, very seriously, and that's why the guidance is so comprehensive.
Thank you. There's also a question regarding the activity of singing. Concerned about unmasking for singing instruments. For those of you who followed this from the beginning, realize that, at the beginning, we weren't quite sure how it was transmitted. We were washing surfaces with bleach every other minute, doing things like that. There is a famous choir practice in Washington State with, I think, 60 some odd people. One person with infection, an hour and a half practice, I think 85% of the people present came down with COVID. So singing in a closed space is clearly a significant risk factor for spread. I'm not aware of what the recommendations are in school for that type of activity. Dennis, do you have a sense, either locally or CDC, what the recommendation might be?
I do. The county guidelines, which also follow the national guidelines, are that if you're singing, you should be masked. It is 6 feet. Last year it was 12 feet. This year it's 6 feet. If you combine it with layered strategies, I think it's okay. It's because the schools have paid so much attention to this, and they've gone through this over the last year. The 6 foot distance plus singing is not going to. It's an issue that the schools have had experience with. I have a student in school who is a singer, and it's been fine. And I think that I would not feel uncomfortable at all with those protocols.
All right. I'm checking the chat here. Younger children who cannot be vaccinated, of course, and that's really 12 and under, or 11 and under, who want to have play dates with their friends after school, inside, outside. We want them to get back to normal, but it's clearly not yet normal. So, I think
I've got one more.
Go ahead, Dennis.
Go ahead, Kip. Okay. I've got one more recommendation with this, is that there is a certain amount of risk tolerance that we all have and we should be aware of. I would pay attention to the county transmission. If we were in early June when there was very, very low transmission in the county, then there were fewer protocols that were needed and we would feel comfortable with indoor play, et cetera. Right now, the transmission is very high. We are in the red zone, in the high transmission category. My personal advice is that, the CDC guidance works here. I think that if you do any indoor play or indoors, that we should be masking. There's, of course, other issues such as, yes, you have to make sure that your friends are not sick. Certainly, if you can play outside, that does reduce the risk. And if there is individuals who are immunocompromised in the household or your own child, that is something that you have to take in consideration. This time of year, outdoors is great. There is little transmission outdoors. It's not impossible, but in less dense settings, I think it's fine. ECDOH does recommend considering masks in crowded settings outdoors, and I think all of these things would protect. I think that if we're still high with indoor play when it comes to November and December, then we reevaluate. Right now, I would not hesitate outdoor, but we have to be scrupulous about ensuring that we are healthy and we wear masks indoors or in close contact. Any adult sets the tone.
Thank you. Alberto, a question came up. Those of us who recall residency realized that we were sick a lot, and it probably had something to do with lack of sleep. And it's been put forward that one of the devastating effects in New York City had to do with individuals who were, and generally because of poverty, working multiple jobs, sleep deprived. This includes a whole bunch of essential workers at different levels. It includes some of the examples from the meatpacking industry in the Midwest, where things really seem to get out of control early on. Do you think this holds goes with the theory that sleep is a big part of a healthy immune response?
It definitely does. I think that sleep is vital for immunity, and it sort of regulates a lot of the hormonal balances that affect your whole life. And so it understandably, shift workers and those that are sleep deprived have higher risk of obesity, and then all the other comorbidities that go along with that, high cholesterol and high risk of heart disease and stroke. I mean, if you think about even sleep deprivation from daylight savings time, we know that around that time there's higher risk of car accidents, strokes, heart attacks, and so sleep is very much important in our daily function. There has been a lot of research also in the lab that have looked at the binding of some of the immune cells, T cells, to infected cells. And what's noted is that in sleep, there's less levels of norepinephrine, epinephrine, and cortisol, and so there's a stronger binding of these attacking cells to infected cells. And so definitely immunity is affected by sleep deprivation.
Yes, I think when we were younger and running ragged, we didn't eat right, we didn't exercise, we didn't sleep.
Right. And when I say sleep, it doesn't matter what time. So you could be a shift worker and function well, so long as you are actually sleeping during the day. So long as you have a routine that is the same day in, day out, then you have homeostasis. You have a balance in your body. So more important than what time you sleep at one point in time is that your schedule is the same. So you could be a shift worker and thrive very well, so long as you are actually awake at night and asleep during the day. It's when folks have an erratic sleep schedule that the homeostasis, the balance in the body is thrown off. And that's when you have other comorbidities that we spoke about.
One question comes up about a parent who has a daughter who's fully immunized, but may have a breakthrough case of COVID. I don't know if that's because of either exposure or symptoms. Negative rapid test, and is wondering what further to do. And I would say contact your pediatrician. In all likelihood, if the degree of suspicion is high, then a negative rapid test doesn't really rule things out, and a PCR test would be the way to go. But that's a question specifically for your pediatrician. One of the things I would mention about how this disease has evolved, early on, I mentioned that pre-symptomatic and asymptomatic transmission was the rule. And some people thought it was 40 to 50% of cases in the younger population, younger being less than 50 early on in the pandemic. In older patients, they typically presented with fever and a dry cough, significant headache, muscle aches, and the mild cases, loss of sense of taste and smell were considered the most common symptom in 75 to 80% of people. In discussions that we would have among national experts, the joke would be the testing supply is limited, but if I wake up the morning and push the brew button on my coffee maker and I can smell it, I'm good to go for the day. It's important to note that with the Delta variant, that has changed somewhat. Loss of sense and smell is not nearly as common. Most patients with symptoms have what are typical cold symptoms: sneezing, runny nose, cough, relatively mild in most individuals. So the disease is changing, and I think it was mentioned by a few individuals here. If you're sick, stay home. The idea of an adult saying, "Well, gee, I got to tough this out. I'm going to go to work sick." Well, that We don't need to infect everybody, and same with children. If they're having symptoms, they really need to be kept home from school. I'd like to take this opportunity to thank everyone for attending this evening. I'd like to thank all of our presenters for their hard work, for their presentations tonight, their hard work in getting it done, and the hard work they and all the health professionals in this community have been doing for the last 18, 19 months. It's been it's not something we had on our radar 2 years ago, but I have to say the vast majority of people have really stepped up in these difficult and challenging times. Megan, thank you very much for putting this together. Everyone stay safe, get vaccinated, wear a mask in the necessary settings, take care of your kids. They need to get back to school. Thank you all and good night.